Cara, really interested to know what role an occupational therapist does have in a community pain service. Can you give us some insight into?
Yeah, I think when patients are sort of referred in to see me, they're normally a bit like, oh, I'm not entirely sure why I'm here sometimes. And my role as an OT is about occupation, and people think of that as being jobs.
Mm-hmm.
And by occupation, we mean the things you do on a day-to-day basis. So whether that's sleeping, whether that's getting yourself washed and dressed, whether that's going to work, looking after your children, running the house, going to the cinema, doing a bit of shopping, it's all those things. So one of the things I've sort of learned working as a psychologist and team really is to try and find out my patients' best hopes of working with me, what they feel, if today's session was useful with me, what has they've taken away from it. So that's kind of where I start off with my assessment with patients. Yeah. Because occupation is such a huge area, so that can help me narrow things down a little bit.
Absolutely. And what common interventions, what common work do you do with patients here in the community pain
We
service?
do a lot about sort of pacing, because obviously a lot of people who have chronic pain, persistent pain, find that the pain stops them doing things. And if we actually look at and analyse what they're doing on a day-to-day basis, we can notice patterns and see that often people think, I'm having a good day, so I'm going to do loads because I'm going to, work through this pain, that needs doing. Well, I'm having a good day, I'll just get it all done. And then they crash and burn. Mm-hmm. And so it's about breaking that cycle, sometimes that boom bust cycle as we call it, and learning to pace ourselves and like break things up into bite-sized chunks. And sort of, that can be quite a lot of work we do. And often I find with people, I totally stole this idea from a bereavement theory years ago. If you imagine your world is like an egg shape, and your world is the white of an egg, and then this pain comes along, it's like the yolk of an egg, and it's quite a big thing in your world. And then that egg white sort of starts to contract around it. You can't do the things you want to do. You can't play with your grandkids. You can't go to work. You can't do the gardening. You can't do the cleaning. So your world starts to constrict. And that pain becomes a larger part of your world. And by working with, the physios and the psychologists and the doctors in our team, the pharmacists, we can kind of shrink that pain a little bit, that egg yolk, but we can also grow that egg white. So the pain, although it's still there, and we're never going to get rid of it, unfortunately, in most cases, we can grow the world so that pain becomes less of a part of their world, and that the things that are important to them, that they value, they can start doing again.
I think it comes back to that lovely point you made as you set up appointments. It is about best hopes. So if that egg yolk is going to grow, we don't want to be too directive, thinking that we know best. And often, you mentioned about pacing as well. How difficult can it be when we meet a lot of our patients and they are massively busy, like being busy, but sometimes they are aware that doing too much can, decrease their ability to manage their condition. How do you go about with those conversations when you do see some?
We all know the principles of pacing. If you say to somebody, talk about pacing, we've all got a concept, of running a marathon. You wouldn't do it from day one, you'd build up to it. And that's actually a skill, and we all have that skill. And so it's finding that skill in our patients and helping them develop that skill. Because they know these things. Yes. We all know it. We all forget it, and we can all improve constantly on stuff. Yeah. So it's about drawing out their strengths and their knowledge and finding things that they value. There's no point in me teaching you to pace yourself doing the housework if that's the last thing you're worried about. Yes. But if we can find about pacing so that you can go out, take your grandchildren out the weekend, that's value to you. So it's finding that value to you and growing that a bit more. And within that, about energy conservation in some respects, as an OT, we often look at equipment and adaptations for people. But that can be detrimental sometimes to people because, if somebody's fearful of bending down to put the socks on, I can say, oh, there's a sock aid, you can do that. But that's not resolving that issue. That's reinforcing that need that you shouldn't do that. So by working with the physios, we can work on that movement and get people doing a little bit more and feeling confident to do a bit more, and then that can build and grow. Absolutely.
So it really brings a lot of evidence for MDT work, and so multidisciplinary work and having a lot of different. And how closely do you work with the physios? Just that example of putting the sock aid on a movement.
Yeah, my clinical supervisor is a physio. So, physio is a huge value in our service. And the MDT sitting down together, we know yourselves, this is psychology. We have a pharmacist in our service as well, talking about medications. Because side effects of medication can be really bad. And so just by learning to take things at a slightly different time, that can make a huge difference in somebody's life. So it's all that kind of knowledge pooled together. I've got skills, you've got skills. You know, I learn a lot from my patients who tell me, "Have you tried this? I never knew that worked." I'm like, "That's really intriguing.
Yes,
how did you come up with that?"
Yeah. And I think in the community pain service, that's when we are really at our best. When I think it was mentioned in a previous video about it's a meeting of expertise. And
that therapeutic alliance, isn't
absolutely, and not going into the room as the expert of I know best. This is how you do pacing. It is about, again, as you said, tapping into what the patient knows already and what it means to them. Tell me more about not putting the expert hat on. That's a really interesting concept you've mentioned there, right?
Yeah, I think we've used sort of a bit of a solution-focused approach, one of these kind of buzzword things, which is about drawing that expertise of patients and finding out what their goal is and where they are towards that goal.
Yes.
And getting them, an example, I was working with a patient who spends part of the time in Spain, fortunately enough, and she's got a swimming pool there, but she can't get in and out the swimming pool now, and she misses the activity of swimming in that. And so I was talking about that and why she can't do that. And her and her husband came with, but there's public pools we could go to. I'd thought of that, but I'm not going to say to the patient that, because it's far more powerful if I can bring people to find that conclusion themselves and just kind of guide them a little bit and draw out their strength and knowledge.
Absolutely.
They're going to take more notice of it if they can understand why it is, rather than going, well, if you did that, it's no value to them saying, we should do that. Well, why should they do that?
Absolutely. And I think that can be a massive challenge, actually, within healthcare appointments, is that you, not to keep up the swimming pool analogy, but you do want to dive in and you do want to actually, make suggestions, which can sometimes enter the room and be quite obvious, but much more powerful when they come from that person. And again, what it means to them personally. I think as well, you mentioned about solution-focused approaches as well. I think the work that we do here can be quite helpful as the assumptions that we have before the session even starts, which is, that, as you said, the patient is always the expert.
Yeah, they've lived with persistent pain by definition for a long period of time. So they've been coping up until that point. They may be wanting to make changes and make improvements in their life. But, they've just got to this point and managing to get to there. They've got skills and beliefs and strengths. And it's reminding them of those sometimes because that world's shrinking and you can open up that world.
And that's a good thing to remember. They have been without us for a while. Our 45 minutes. Again, go back to what Chris Barker mentioned earlier about when 3 o'clock in the morning gets quite tough. We're not there. And, let's be curious to see how people have got this far without us and asking that as well. It's also quite a good question to ask. How have you done this? How have you got this far? And the assumptions actually that the person in the room has already got the tools before we even begin talking to solve the problems or to be the person that they want to be, I think is always a good start.
And by growing that sort of nervous system, and I often encourage people we talk about growing the nervous system being amplified by all these things going on. If we can soothe that nervous system. So one of the things I get patients to try and do maybe is to do something nice for themselves each day, whether that's making themselves a really nice cup of coffee, whether that's spending 5 minutes looking out the window watching the birds, because I think that all is breathing into that system of soothing it all down. And that well-being as well. It's that living well despite having chronic pain.
Yeah, absolutely. And I hope one of the things that does run through the service is, how can we calm those threat responses? Is it through physiotherapy? Is it a good conversation with the doctor? Is it knowing that you don't need to go for a scan? Or is it through breathing? And noticing all of these things that can initiate those soothing systems and quieten those threat systems down.
And having that
can be quite
smorgasbord of things to just pick from and go, well, that's not really gelling with me. Let's try this approach and let's try that. And, picking and choosing.
So, I suppose in summary, it's about occupational therapy. It's about listening to the person as much as possible, growing their world as they would like it to grow. And allowing the patient to be the expert, because after all, they've been without us for a while.
You should be 90.